Cough, fever, and night sweats may be a sign of tuberculosis. For a while, tuberculosis or TB seemed to be a disease of the past. Improved medications and the isolation of infected persons helped decrease the prevalence of this ailment. But stronger forms of the bacterium have caused a marked resurgence of TB. Even powerful drugs are not as effective in killing these new TB germs. TB infections most commonly occur in the lungs, but can spread to other parts of the body. A cough is often an early symptom. Tuberculosis is usually accompanied by weight loss, an overall ill feeling, and night sweats. TB can spread through nursing homes, attacking senior citizens, the debilitated, and AIDS patients. But there are also outbreaks of TB among healthy individuals. These outbreaks are more likely to occur in close quarters where air is recirculated through air conditioning systems. Fever, cough, and night sweats warrant immediate evaluation by a physician. If you have tuberculosis, adhere to your medical regimen, since the disease can be fatal. In addition to tuberculosis, other causes of these symptoms are other infections of the lung and cancers such as lymphoma.